This is USVI News, your Virgin Islands connection.
Hi, everyone. Thanks for joining us for USVI News. I'm Emily Matson. Legislation is now underway that seeks to provide the VI legislature with more oversight when it comes to federal and emergency funding being used in the territory. Senators have been expressing concern for years over emergency funding from the 2017 hurricanes and other funding being used efficiently and timely. Our USVI News' Ali Bourne-Vanek has the latest.
The VI legislature moved forward this week legislation that would give more approval, appropriation, and allocation ability when it comes to federal funds and emergency funding coming into the territory. Senators shared that they hope that this legislation and oversight would help federal funds be facilitated faster in the Virgin Islands.
It is necessary that we verify and ensure that the federal relief funding is utilized within the prescribed parameters so that the people of the Virgin Islands do not become, at the end of the day, this body responsible for repaying 1 penny of these funds. When we received the ARA funds, there was a transparency website where we were able to see all of how the funds were spent and to whom it was spent for. So the expectation here should be no different.
We were left out of the loophole when it comes to the federal funds and a state of emergency, and we must be part of the process. The people put us here for that purpose. We have oversight responsibilities. We control the purse strings of the government. And in doing so, I must say that it's a good piece of legislation. Many other states have done the same thing. To include, some states have put in oversight boards. Some have done websites, etc. They're being very creative with their oversight authority. And we will be doing the same thing here in the territory.
The major responsibility of the legislature is to deal with the purse strings. And when it comes to these federal dollars, and when I sat here in a Senate hearing a couple weeks ago, and to hear the governor's finance representative say that when it comes to some of these funds, there was certain aspects that they could just spend without any kind of checks and balances, was a huge concern of mine. So I'm very happy that this piece of legislation is going to be in place in order to curtail and take accountability for these funds and making sure that they go to the various areas where they need to assist the people of this territory.
This is no different to what is being done in states across the nation. So this isn't something unique to the Virgin Islands. This is just an attempt for us to make sure that the money is spent where it's supposed to be spent.
This legislation received unanimous support. Up next, it moves forward to the Rules and Judiciary Committee, where they hope that they'll have testifiers from the executive branch. In St. Thomas, Ali Bourne-Vanek, USVI News.
And of course, we'll keep you posted on the status of that legislation. As the Delta variant continues to fuel an increase of COVID cases across the nation, we want to get you the latest look at the current positive case counts here in the territory. Currently, there are 177 cases throughout the VI. Positive case counts have risen recently since the VI Department of Health confirmed the highly contagious Delta variant has been found in the territory. There are 57 active cases in St. Croix, 118 in St. Thomas, and 2 in St. John. Most of these cases are among unvaccinated individuals. Meantime, 3 inmates at the St. Croix prison have tested positive for COVID-19, leading the facility to step up its continued efforts to stop the spread of the virus. The inmates are housed at the John Bell Adult Correctional Facility. On Tuesday, an inmate tested positive for coronavirus after complaining of mild flu-like symptoms. This was the first confirmed case of COVID-19 at this prison since the start of the pandemic in March of last year. In response, the Bureau of Corrections immediately conducted COVID tests of all inmates and some staff. An additional 2 inmates tested positive who were housed in the same section as the first infected inmate. So to mitigate the outbreak, those inmates were isolated from the general prison population. None of the infected inmates have required hospitalization and are being closely monitored by prison nurses. The entire John Bell Adult Correctional Facility has been placed on lockdown with continuous disinfectant and cleaning. Inmate movement has been restricted within the facility and all visits are suspended. When it comes to the coronavirus, a major shift on masks. Here in the Virgin Islands, mask mandates have remained in effect despite the CDC saying just a few weeks ago that vaccinated people could take off the masks. But with cases rising, the CDC is now doing an about-face nationwide, recommending even fully vaccinated Americans wear masks indoors in certain parts of the country. The move coming just weeks after lifting that same guidance.
This morning, federal health officials are defending the CDC's reversal on masks. Once again advising Americans, even vaccinated ones, to wear them in public indoor spaces, including schools, in areas with high virus transmission.
What was not really as well understood is the capability of this Delta variant to transmit so readily among people.
The CDC says new research finds Delta is linked to rare but rising numbers of breakthrough infections in fully vaccinated people who could be carrying higher levels of the virus than previously thought, increasing their risk of infecting others. The unvaccinated are still the most vulnerable, making up almost all of COVID hospitalizations and deaths.
People need to get vaccinated. That's the only way we're going to cut this thing off. Nobody likes wearing a mask.
But some officials are pushing back. Iowa's governor says telling fully inoculated Americans to wear masks is counterproductive to our vaccination efforts and doesn't make sense. The call for masks in schools, even among vaccinated teens, has ignited protests from Virginia.
Take the masks off our children.
To Illinois.
I need to breathe.
Parent Ambria Aber is fed up and has decided to homeschool her 11-year-old daughter.
How confusing of a time is it for parents right now?
I think it's very confusing. It's hard to keep them in it like all day because, they get tired of it.
More than 50 medical organizations say all healthcare workers should be required to get the COVID-19 vaccine. The dozens of organizations signed a joint statement calling for COVID-19 mandates for all workers in healthcare and long-term care settings. It said the mandate is the logical fulfillment of the ethical commitment to put patients and long-term care residents first and take all necessary steps to ensure their health and well-being. The statement cites the rising number of cases, hospitalizations, and deaths throughout the country and says vaccination is the primary way to put the pandemic behind us. The woman considered by many to be the greatest gymnast of all time has pulled out of yet another event. USA Gymnastics announced early Wednesday morning Simone Biles has withdrawn from Thursday's individual all-around competition to focus on her mental health. The world's most acclaimed gymnast shocked the sports world earlier this week when she removed herself from the team final. After appearing to lose her focus, Biles says she wasn't mentally ready to finish that event. The individual all-around competition was set for Thursday. USA Gymnastics officials say Biles will be evaluated before deciding whether to compete in next week's individual events. Jade Carey will take Biles' place as the individual all-around for Team USA. Simone Biles again shocked everyone with these announcements, especially those who are in gymnastics. At first, everyone thought it was due to an injury, but she later told reporters she felt fine physically, but emotionally, things were really taking a toll on her. And gymnasts our USVI News' Mike Ruzzi spoke with at a gym in Pennsylvania are in agreement it's not easy carrying the gymnastics torch.
We stopped by the Erie Gymnastics Center today and visited with local gymnasts and the center's program director and coach. Now, he's been involved in the sport for 30 years and was not surprised by the Biles withdrawal.
How difficult is this sport from the mental aspect?
I want to say that's most of the sports. A mental block, it happens, but to happen at this time is just critical for us. I mean, it's critical for our industry as a whole.
The Erie Gymnastics Center roster includes 2 level 10 gymnasts. They practice 5 days a week, 5 hours a day, and their session includes the same routines as Biles.
It's mentally and physically hard on your body, so I wouldn't say it was very shocking. I mean, it was, but I know it happens sometimes,
and I feel what she's going through, so I just give her, I feel like love and support is the best thing to do right now. She does amazing flips and everything, and she's so caring for everybody else.
She helps me actually physically and mentally, like mentally because I know that it's a goal for me to do.
Definitely a physically and mental grueling sport. Now, the CEO of the U.S. Olympic Committee said Biles' decision to prioritize mental wellness over all else should be applauded.